case that was described was inappropriate. I can't imagine creating a psychological, physical monster like that with big, huge breast implants.
Yeah, so the first doctor who did it has to examine his own conscience then.
I agree.
I doubt if he is. Do you? I mean, I just think that
Unfortunately, I think you're probably
well, you know,
right.
that brings up a very important point, which I think, Laura, you take issue with, not particularly Dr. Perlman. He happens to be on the hot seat this morning.
He's a good guy.
He's a good guy. But with doctors who justify just doing everything they can, perhaps maybe to get a fee.
Well, let's face it, when you think of medicine, you think of somebody committed to heal. You don't think of somebody committed to cutting healthy tissue to change somebody's appearance. And I don't mean reconstructive surgery because there's a gross deformity or burns or an accident or any of this.
Are you against cosmetic surgery, Laura?
You know, I tell you, I struggle with this. To be honest with you, I struggle with it because I'm under the same societal norms of how I should look. I'm sitting here with makeup, nice clothes, earrings.
Yes.
I'm trying to enhance my appearance, so it's how far you take it. But in watching some of those pictures, you know, some woman having implants put in her calves, it drives me crazy to think of how frivolous we are about changing our body parts as though that really meant something about our value. So actually, the more I watch some of that, the more negative I started to feel about the whole process.
Really? And as he was doing it, I was thinking, oh, look at that. That's great. How much and how much does it hurt?
Oh, really?
I must say, though, in 10
But
years...
isn't that sad that you're thinking that way so easily?
But
No, instead of
maybe
accepting how we are as individuals.
But you know, the
say what
reality
you're
is,
gonna
in
say.
my experience, in 10 years of performing plastic surgery in Beverly Hills, I could have hundreds of women and men lined up here just to tell you how thrilled they are with the change.
That's
They
true.
grew up with a sensitivity about prominent ears, and when their ears were finally set back, they were just joyously happy. Now, nobody would think that that's going to correct their marital problems or their difficulties with work or deep-seated psychological problems related to relationships with their father in childhood, but for many normal people, it is an uplifting, beneficial procedure.
Even for people with minocytopathology.
With
that
what?
Is who have some, sorry, who have
I would have it
very
removed, whatever
small
that is.
amounts of, you know, when they've done excuse me, when they've done testing on people who have gone in for reconstructive surgery, plastic surgery rather, and not, you do find when they do psychological testing and profiles that the people who do go through do have elevated areas of problems emotionally, of insecurities and problems with their sexuality and identity. None of that precludes them going through a good treatment procedure and being satisfied afterwards.
Well, you know, yesterday we had a show on hair, okay? And we found out from women all over the place that hair is very important. I'm sure it is to you, Laura, as to you, Dr. Jon, because it is important to men. So that's just another way of enhancing the way you look. Now, let's talk from both your point of views, from the physical and the psychological, about who is a good candidate for cosmetic surgery and who is not. Dr. Jon?
Well, I think it's important that a patient come in with realistic expectations. I watch out for somebody who's had multiple plastic surgical procedures and yet remains dissatisfied. I think that's a red flag. I want somebody who does not show excessive preoccupation with their appearance, and somebody with an abnormality that I think is amenable to change. I like to go home and sleep well at night knowing that what I'm about to do the next day is reasonable, is justifiable, and is very likely to satisfy the patient. But if it's not the case, I don't want to operate on that person.
Cheek liposuction is what? That's not an abnormality.
Having round cheeks is not a terrible defect, I agree.
How is
with
that
you.
a defect at all?
Well, it's not really a defect, but if you want an
You're taking
enhanced...
normal tissue.
Yes.
But if the person
You're doing
thinks it's a
destructive
defect,
actions to normal tissue. Somehow that doesn't seem like the operation of a physician, which is to heal.
Well, this is cosmetics, and part of cosmetics
know.
is makeup. It's also sculpting the face. It's enhancing the image. If somebody is preoccupied with a round cheek and always desire to have a nice sculpted look with a prominent cheekbone, I don't think it's unreasonable as long as they have a realistic appreciation for what can
Like
be
they're not
gained and
going
the
to say,
limits of it.
this will get me a guy, is not,
Exactly.
is, you know, if my cheeks were just smaller.
okay, Laura, you
Oh, the
partially
scary thing is
answered
it
the
might.
question. Who do you say is a reasonable candidate for cosmetic surgery and who is not?
People who are doing it for themselves. If somebody's spouse or partner or family is forcing them to change their nose because it looks ethnic, or change their breasts because he'd like to walk around with some lady who has bigger breasts, if it's an external imposition, that's not a good person for
We're
her.
totally with that.
Yeah.
Yeah.
Somebody who inside themselves feels that this would make me feel better is going to be a better candidate.
All right, hold it right there. We're going to take a break. When we come back, we're going to address the two things that you want to know, Gail, which is, does it hurt and how much does it cost? And we will give you in the audience your turn next to ask your questions as well. But we'll be right back.
let you go without knowing this. All right, new nose. How much would it cost me if I just wanted somebody else's nose?
Of course, it depends on what area you're having the surgery in, what city and what town.
Oh, I
but
thought
if it's
this
done
area.
in a plastic surgeon's office, it would cost from a minimum of about $2,500 up to maybe $5,000 or $6,000.
Okay, so now I'm going to stick with this nose for a little while. Does it hurt?
Nose surgery is uncomfortable, sore. It is moderately painful for a few days, but by the end of a week, most of the pain is gone.
Are we talking Tylenol or morphine?
The first night or two, something in between, but mostly Tylenol.
Okay.
Now, we have a woman here in the audience from Kansas City. She has a beautiful name. It is Lyric. And Lyric has a husband who's hung with the same nose for a long time. But you know, it is a trend of the 90s. Seems to be. What about it?
I don't know if it's psychological why he could be satisfied with this nose for the last 50 years and suddenly want a new one.
Good point.
He wants a new one now. Is it midlife crisis?
Good point. Very good question you're asking, because most of the plastic surgery articles that deal with this really indicate if the person has from childhood been not happy with their nose, you know, like from a little kid, that's usually a good candidate for the surgery. But when somebody spontaneously starts obsessing on some part of their body, then I'd be more concerned with having a consult, a psychological consult before.
How do you feel about his nose, Lyric?
I'm perfectly happy with the nose
She
he's had
likes
forever.
Tell him you think it's sexy the way it is.
It's sexy.
But also, there's something going on with him, and that's worth investigating.
Yeah, and this brings up another point, which is, don't both of you see a lot of people who are in the throes of a huge change, like divorce,
I do, very commonly.
and then they want something else changed?
It's interesting. I see a lot of women come in either after a separation or the loss of a spouse or prior to a separation to have some cosmetic surgery done. I always feel it's kind of sneaky. Before they tell the guy they're leaving him, they want to have their breasts done. Or their
That's
eyebrows
true.
done.
That's
so he
true
gets to pay the
statistically.
$6.
And also, he could pay for it, right? So the old husband pays for the new husband's pleasure.
I don't think women
Right,
think
in the
that
old
way.
days, they used to get their
Thank
teeth
you.
totally redone, right? Here's Carmen. Carmen, you have what to say?
Yeah, I'd like to ask the doctor, what's the most unusual surgery you have ever done?
Well, this isn't cosmetic, and it was back in the days when I was a plastic and reconstructive surgical resident at UCLA. We had an unfortunate man who was having some very deep psychiatric problems flown in by helicopter who had amputated his own penis. And we replanted it under the microscope that night. That's one operation I'll never forget and hope not to have to repeat.
So there's you can't. Oh, so you wouldn't want to repeat that actually,
was
especially on the
difficult.
same person. No.
Yes.
Okay, we have a young man here named Dave. He's got a question.
Does age ever become a barrier to doing plastic surgery, or how old is too old?
Are you asking me or Dr.
Yeah.
Schlessinger?
How old is too old?
Yeah.
Is this for yourself?
I know.
He's a
They
handsome young
always
man.
say that, right?
It's for his great-great-grandmother.
It's not so much chronological age that's important. It's not if you're 70 or 80, but it's the physiological age. I've operated on 80-year-old women who really acted and looked and were as healthy as a 60-year-old who exercised and were active. So it's more important how well-suited the patient is physiologically, how healthy the person is.
And do their friends know the difference, or do they basically just see it themselves in the mirror?
I love to ask questions like that after surgery. It's very gratifying that people comment. Sometimes nobody says a word, but they all know it. They don't want to say anything about it. Other times people think they've lost weight, been on vacation. It's fun.
You know, a crucial question is, how do you pick the right cosmetic surgeon?
No, yes.
How about that, doctor?
You talked about board certified and all that. How do you
finding
know
a
who's
doctor
right?
truly board certified in plastic surgery is important, and there are two numbers that we can give to you. One is the California Society of Plastic Surgeons, which has an 800 number, 722-2777, and they will refer you to a board certified plastic surgeon in your community. The other is the American Board of Medical Specialties at 800-776-2378, which will tell you what board has certified a physician who claims to be board certified.
Okay, some good advice. Plastic surgery, the cosmetic of the 90s. We'll be right back.
To be a part of the Kelly and Gail audience, call 818-846-5364 for free tickets.
So why do I love this stuff? I mean, I could talk about this all day long.
Well, you and everybody else, people want to know about it. They're listening, and they're doing it.
They're doing it.
No matter what Dr. Schlessinger says or Dr. Perlman, they are doing it.
What I love is, like, if you meet a guy and a guy meets a woman and they've both had a nose job and they don't tell each other. then they have a kid, and like they're both blaming each other. They're shocked that the kid
Child
has
has
a big
this
nose.
huge nose, right? Oh, please. That's the way it is, I guess. Okay, but of course the point being made that you've got to make sure that you are the right candidate, you know, psychologically and physically, and that you find the right person to do it. Tickets, please come see us. We're at 818-846-5364. Come and be in our audience tomorrow. Over 50 and who's counting? Be fabulous. Have a great day.
Kelly and Gail's wardrobes furnished by Carol Little. Transportation and protective services furnished by the Entertainment and Special Services Unit of West Coast Detectives. Hotel accommodations for guests of Kelly and Gail are furnished by the Universal City Hilton and Towers, Universal City.